Coronavirus cases are climbing again. A handful of Illinois counties, including suburban Cook County, are at medium risk of transmission. But a lot of other things are going around too. Amanda Vinicky spoke with several doctors today and is here to share their advice and insight on how to tell whether you've got COVID or just plain old allergies. Amanda.
Yeah, Paris, it has been gloomy, gray, it has been cold, but flowers are beginning to bloom and trees are growing buds, signs that spring is arriving in earnest. And it's lovely, but for those with seasonal allergies, nature's beauty can come at a price. Clogged sinuses. And that is prompting calls to Rush primary care physician Lisa Ravindra.
We're hearing all of it, and it's really an uptick in the last couple of weeks. And it is so hard to tell, especially over video visit or telephone or my chart message, what we're dealing with. There's so much overlap in all of the symptoms, from a cold to COVID to another upper respiratory symptom to allergies, the flu. All of it's out there right now, and it's so hard to tell. So people are presenting with stuffy nose, nasal congestion, cough, a lot of post-nasal drip I'm seeing. Sore throats.
A whole lot of yuck that Dr. Allison Bartlett has likewise seen when she's working with patients at the University of Chicago's Comer Children's Hospital. She says she also lived it when members of her family got a non-COVID, non-flu respiratory virus. And she too says it can be hard to decipher what is what, though there are some clues.
There's so much overlap, and some of the other viruses that aren't COVID or flu are even trickier to solve. But certainly, right, a fever, feeling so exhausted that you can't get up and get going, those we don't think about in terms of allergies. We think about those more in terms of an infection, as opposed to the sneezing and itchy eyes and sort of itchy nose and mouth. That suggests more allergies.
Another trick, check out Loyola Medicine's allergy count tweet of the day. No worries today on grass or weeds, but it is tree allergy time. Loyola has done a pollen count for decades, and it is Dr. Rashna Shah's responsibility now. Shah says that literally this involves sampling the amount of pollen in the air in the metropolitan Chicago area over a 24-hour period using this machine that's on the roof.
And it has a slide. And this slide moves every 15 seconds and sucks the air that's kind of floating by it. And the pollen deposits on that slide. And then what we do is we bring that slide down every day and we read that slide. And by reading the slide, I mean we stain it, and then we literally are counting how many tree pollens and what kind of tree pollens, how many mold spores, all of that.
And that is helpful information to scientists, to doctors for any number of reasons, but it also can be helpful to those of us who wonder if we're suffering from allergies, from COVID, or from something else. Shah says that grass season should be starting any day now. The tree allergy season, it is lasting longer. With climate change, both trees and grasses are producing more pollen and can be more allergenic. So if you know your triggers, check out the daily count. You can also look at the chart that shows if you're in what I'm going to unscientifically dub the red eyes and nose range.
Looking at that data, looking at those reports kind of allow us to form patterns with our symptoms. So let's say one day trees are high and we have more symptoms, and then the next day trees are low and we have much less symptoms, then that correlation is sometimes very important.
Now, losing your sense of taste or of smell, as we heard a lot about early in COVID, that is a COVID-19 symptom, not likely to be allergies. But Shah says with recent variants, that's less common, and so it is much harder to tell. Dr. Bartlett has a suggestion. Take allergy meds, see if they help. Also, she says as temperatures rise, as it's hopefully going to be nicer to be outside, social activities outdoors are certainly safer. Otherwise, she says her COVID risk benefit analysis goes something like this.
I'm vaccinated, my family's vaccinated, so that's a nice layer of protection for us. But there are plenty of people who are unvaccinated or immunocompromised, or all of our children who are less than 5 are unable to be vaccinated. And so those are potentially concerning features. I think about the protection that had been afforded by knowing anywhere I went out in public, people would be masking to protect themselves and me. That's gone. So that ramps up my risk a little bit.
Again, she says this is all a risk benefit analysis. And if there is any doubt, you should really take a COVID test.
Allergy symptoms, if it's something that patients get every year around this time and it's similar to the symptoms that they're having now, that's a good sign. But I think it's always safer to get the COVID test.
And if you don't feel well, then stay home. If you're unable to do that, please do. Doctors all say wear a mask for the protection of yourself and for the protection of others, regardless of any government mandate or lack thereof, because getting sick with COVID or other respiratory infections is nothing to sneeze at. Paris, back to you.